Hi, I'm Annie. I'm a student nurse, level 1. I was actually wondering if I could shadow you today.
Definitely.
Okay. And I understand you're working on a patient right now. Can I get an SBAR report on that patient?
Yes, Mr. Kindrider. He was admitted in the hospital by Dr. Phillips' office. He's a 67-year-old man, 5'11", with his full coat, and he was admitted because for the last 3 weeks his glucose blood levels are very high, around 300. So he has diabetes 1. He has a history of 20 years of diabetes. He used to work in the automotive industry, which probably was the trigger for him for this disease. As we know, diabetes 1 it's an autoimmune system triggered by toxins or virus.
Okay.
And he has a history of hypertension as well. Could be genetic as well, as his mother died of stroke. His father had a myocardial infarction, and he was admitted for a wound on the lateral aspect of his heel that is not healing.
Okay.
On assessment, everything looks fine. He has pain, and he's taking currently medication for that as well. We have aspirin, we have morphine, we have a morphine IV on the median lateral vein, and he's taking garbentine, so he has sensory neuropathy because of his diabetes.
Okay.
His lung sounds are clear. His breathing is unlabored. He's on a 1,800 calorie diabetic diet with 2 grams of sodium, and probably that because of the hypertension. His urine is clear. He's yellow, and the heart sounds are clear. Her pulses are strong. There's no edema present. All the bowel sounds are present in all 4 quadrants, and he has a good appetite.
Okay.
My recommendations for today, it will be to check his blood pressure, just to make sure that he's within normal range. Last time at 1550, the blood pressure was 145/72. At 1645, his blood pressure was 128/70. So blood pressure should be monitored. His blood sugar was 290 at 1645.
Well, that's a little high.
Very high. So we'll administer insulin today, a regular insulin for that.
Okay.
And we have to monitor even his respiratory rate because he's taking morphine. So we want to make sure that he doesn't have a respiratory depression. And probably for the future, the liver function, just because the ALT was slightly higher.
Okay. Now, why specifically are you giving this client that medication, the insulin?
Because we just want to make sure that the body will uptake the glucose, and the cells will be able to metabolize it. So the glucose will go, and cells will be able to use that for energy, and blood glucose will drop.
Okay, so is that the action that the medication has on the body?
Yes. To lower the blood glucose levels,
okay.
That will be the action.
Now, when should you question administering this medication?
I'll say probably if I will ask the client if at awakening he has any nightmares, sweatings, or if he has headaches. I would just probably want to double check if he has probably stomach effect, if his blood glucose levels drop during 2 and 4 a.m. So just in that case, or if his blood sugar is too low.
Okay. Does this medication have a therapeutic serum level?
No.
Now, which vital signs would you monitor?
As I said, respirations, blood pressure, glucose level, and pain.
Okay. And which physiological parameters should be monitored when the medication is being administered?
We would like to check that the site of administration is rotated every week. So you want to monitor and you want to monitor as well for allergic reaction. And if the site presents lipodystrophy, we'll definitely not do it there.
All right. And what interventions would you teach the client in order to ensure this medication is being administered safely in a hospital setting?
In a hospital setting, just to monitor the blood glucose levels, probably I will teach him the signs of hyperglycemia, hypoglycemia, just to be able to let us know if he feels, first of all, that something is not right, and we'll double check the sugar level and administer insulin accordingly.
Okay. And what interventions would you teach him to take the medication safely at home?
Because he has sensory neuropathy, I would say this means that he has a limit fine movement. So probably administration, we'll see if he's able to still use a syringe or maybe a pen. It will be more useful for him.
Okay. And are there any specific side effects or potential adverse reactions to this medication?
Hypoglycemia.
Okay.
It will be low blood sugar, which ultimately will lead to a hypoglycemic shock. So we just want to monitor that he's eating while he's having the insulin. He has appetite, otherwise, or hyperglycemia.
Okay. And how do you know that the medication is effective?
We'll check the blood sugar within 2 hours to make sure that, if the blood glucose reach at a level between 7 and 120, then we'll know the medication had a positive effect.
All right. Sounds good. Those are all the questions that I have for right now.
Thank you. Are you ready to go in to meet
Yes.
Mr. Ryder? Knock, knock. May I come in, Mr. Ryder?
Sure.
My name is Gina. I'm going to be your nurse for today, and Annie is a level 1 student, will be shadowing me today. Is that okay with you?
Sure, no problem.
Hi there.
Hi.
So for today, because we took a blood sugar test at 1645 and your level was 290.
Wow.
Because of that, we have a doctor's order right here between 241 and 300 to be 16 units of insulin should be administered sub-Q.
Okay.
Is that okay with you?
You say so.
Do you have any allergies?
I don't think so.
Do you recall this morning on awakening having night sweats or any nightmares?
Not this morning.
That's fine. Do you feel like eating?
Yeah, I think they're supposed to be bringing my food soon.
We already ordered, yes, for that. And just to make sure, whenever you don't feel like eating, you need to let us know, because we can bring some carbohydrates for you or regular soda. Or if the patient doesn't feel like eating, if he feels like eating, we'll make sure that he has a lot of diet, gelatin, and water. Okay?
Okay.
And as I said, the food is already ordered. You said you don't have any allergies, right?
No, I don't think so.
Okay. What else did I want to say? Now I'm going to wash my hands. I'm going to raise the bag. Which is your preferred side?
Usually my stomach.
In your abdomen. Okay. So I raise the bag.
Okay.
And now I'm going to double check the order. So I have regular insulin. The expiration date is good. It's clear as it's supposed to be. And I'm just going to double check the doctor's order. Okay, so it's 16 units for a level between 241 and 300. May I have your name and your date of birth?
Yes, it's Ryder Kind, and I'm 67 years old.
Okay, thank you so much. And again, Mr. Ryder, just to double check again, insulin regular, administered at 1645, sub-Q and 16 units. Okay, perfect. Now I'm going to take some gloves. So you feel like eating today, right?
I'm pretty hungry.
Okay. Later on, I have some recommendation food-wise for nutrition and for exercise.
Oh, great, great.
We are going to clean. Perfect. Now I'm going to clean the side. It's a little bit cold.
Oh, yes, it is.
Perfect. Okay, so now first I will administer 16. I'll take 16 units of air. Okay, before doing that, I would like to scan to make sure that perfect. And now I'm going to try to scan a little bit your ID just because I think that perfect. Mr. Ryder, right? And now, perfect. So I'm going to double check again. Insulin, regular, 1645, administration, sub-Q. And now I'm going to inject the air. And withdraw 16 units. Would you like to double check? 16 units.
16 units, it looks good.
Right. Okay, and it looks clear, there's no bubbles, it's perfect. So, are you ready, Mr. Ryder?
Sure.
It will not hurt, so. Perfect. I'm not going to recap it, I'm just going to throw it.
That doesn't hurt too bad.
Right. Do you have any questions for me? Do
Oh,
you have any concerns?
yeah, all those chocolates my daughter sent me. Can I still eat those?
Not really, not.
Oh, shucks.
But my recommendation for you, as I said, I have a 1,000 calorie diabetic diet that I would recommend, and you can choose and fit and plan your meals accordingly as you feel like eating. As I was saying, I know that you like to drink beer. Make sure you have the alcohol with the meal, that it will increase.
Okay.
And while you are taking, I think the thiazides in alcohol will increase your glucose level as well. I heard that you like bowling, which is phenomenal. You can still do bicycling, for example, for 2 days and bowling for 2 days, but double check your sugar before, after, during the exercise. If you have ketones in your urine, if you double check, don't do any strenuous exercise. You can still do bowling, but not strenuous exercise. So
Should I wait till that wound heals on my foot?
Yes, as well.
Okay.
Definitely. So here are your diabetic and foot care for your feet. Just make sure that
great.
is clean and maintained. And the shoes, never wear open heel shoes. Leather shoes will be comfortable. So make sure that if you cannot inspect your feet every day, ask somebody else, maybe your wife. They can take a look as well. And if you have even a blister, call the doctor within 24 hours and check your blood sugar every 4 hours.
Yes, ma'am,
Okay.
I will do.
So these are for you. Enjoy. Your meal is on the way.
Okay, thank you.
Thank you so much.
Thank you for letting me visit.
You're welcome.
And now I will document that the insulin was administered. I will leave the bed down. Sorry, I forgot to leave the bed down for your safety.
Oh, okay.
And your cola is within your reach. And your newspaper is back.
Okay, thank you.
My pleasure. Thank you. And now I will just document that it was given.
And I do have some questions.
Please do.
Okay. Were there any pertinent pieces of information that you reviewed before administering the client the medication?
The blood glucose level, definitely, and just make sure that it was administered within the range that the doctor prescribed.
Okay. Did this information affect your decision to administer the medication?
No.
And did this...
Seems that we've had a power outage in the hospital.
Keep going.
Did this information affect how you administered the medication?
No. If it was the same side that we used for the last 2 days in the abdomen, there was no allergic reaction. There's no lipodystrophy, so therefore no.
Okay. Well, those are all the questions that I have today. I really appreciate you letting me shadow you.
It was my pleasure. Thank you.
Thank
being
you.
with me today.